Hi, my name is Heather Garcia, and I'm going to be performing a newborn assessment today on this doll. So when a newborn is first born, there's an APGAR score that is done in the first minute and 5 minutes of life. Um, there's two scores, again, at the first and 5 minute mark. If the score, we assess 5 different areas and a score of 0 to 2. If the score is from 7 to 10, that means the newborn is okay. If the score is from 4 to 6, it's on the lower end, and if it's 0 to 3, it's on the severely low end. So the baby might be placed in the NICU and might need some extra TLC in the first few minutes. Otherwise, we can proceed with our assessment, and the baby can also bond with the mommy. So when we first assess the newborn, we're still going to take the head-to-toe approach that you take with a full-grown adult. We're going to assess the fontanelles, the anterior and the posterior, and make sure that they're soft. Something we're also going to look for is symmetrical features of the face. The eyes are symmetrical, the mouth is symmetrical. We can test for the rooting reflex. You just brush their cheek. We can test their sucking reflex, and when you do that, you're going to feel the top of the mouth and make sure there's no cleft palate or anything like that. We're going to assess the ears and make sure that they're fully developed and symmetrical. Sometimes, or not sometimes, there could be a little dimpling by the ears, and that could also indicate a kidney issue. You're going to make sure that you're going to move further down in your assessment. You're going to assess the newborn's shoulders. And what I've seen done in the nursery is they push down and you assess for crepitus, which would be like a clicking or popping sound, almost as if you're pushing on little bubbles. Once you move past that, you're going to look at the arms, make sure that the fingers are all there, 5 and 5 on each hand, so you have a total of 10. You're going to assess the stomach of the baby. You're going to listen for any bowel sounds. You're going to listen to the heart. You'll be performing your vital signs also during all of this. A heart rate for a normal newborn is 120 to 160. You'll also look at the respiratory rate. A normal respiratory rate can be from 40 to 60. So it's on the higher end. It's not what it is for an adult. So you're going to go down. You're going to look at the abdomen. You're going to look at the reproductive area. If it's a female, you're going to look at the labia and make sure it's even and symmetrical. If it's a boy, you're going to make sure that the penis is developed and it's there's no like hypospadias going on, anything abnormal. On both, you're going to look where the umbilical cord was cut and make sure that it's okay, and there's going to be 2 arteries and 1 vein, and it'll be clipped and clamped. You're also going to move down further in your assessment and look at the legs. You're going to make sure they're even. Also, similar to when you were testing for crepitus, you're going to do a similar motion to test for any clicks around the waist area on the baby. So you're going to make sure the legs are the same length. You're also going to look at the toes as you did the fingers. Make sure there's 5 on the left, 5 on the right. When you're down in the feet area, you can test the Babinski reflex. So you're going to run your finger up the center of the foot. The toes will fan out and the great toe will fan in. So once you've made sure that everything is okay with the baby on the front end, then you can flip the baby over onto their belly carefully. When you were doing the assessment on the front, you just want to make sure you were supporting the head. You don't want it to flop around. It can cause further problems. So when you're looking at the back, you're still just looking for symmetrical features. You want to make sure that the spinal cord is straight, developed, nothing abnormal. You're going to look at the buttocks of the baby. You want to make sure that the folds of the gluteus are equal, nothing abnormal there. Excuse me. Also, when you're doing this, you can assess the baby's ability. Once you're done assessing the back of the baby, then you can assess the baby's ability to move forward. So you just pick them up, and when they're about to walk, or they're not going to walk, they're going to do like a walking motion in the air, and that's a normal reflex. Um, so yeah, that's what you're going to do with your baby and the assessment. The first temperature you're going to do on a baby is a rectal temperature, and if that's normal, then you can go forward. Moving forward, you can just do any other kind of temperature. Again, I said you would do your vitals. You're going to make sure their respiratory rate's okay. They're not in any respiratory distress. If they appear like cyanotic or like they are in distress, then you're going to want to take a pulse ox and make sure that their oxygenation level is acceptable. I said the heart rate earlier is going to be 120 to 160. You're going to want to listen for any murmurs or anything. On the back side, I forgot to say, when you're looking at their skin, baby might have Mongolian spots from delivery. That's okay. They can go away. If during the delivery they needed any assistive devices, you just want to make sure the baby doesn't have any marks or anything that could hurt or further causing them distress, basically. You just want to make sure the baby's not in any distress in those first critical moments of their life, because these are the times that you're going to want to get help really quickly. So really just make sure the baby's not in any respiratory distress. Make sure their heart rate's okay. Make sure everything seems to need the importance of being symmetrical. So like I said, legs symmetrical, face, ears, arms, spine, everything. You can test the Babinski reflex, the Moro reflex, the plantar. You want to see if they can grasp your fingers. I talked about the sucking reflex. And if everything is normal with the baby, then you can move further and you can bathe the baby. When I did my clinical roundings, a lot of the nurses would actually do parts of the assessment during the bathing, because you have to move the baby around. So they would combine everything in one, because everything is about efficient time management. So just make sure everything's okay with the baby, and if the baby can then be brought to the mommy to have some bonding time, then that's what we'll do.